Hey all, welcome back to the Real Life Pharmacology podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, go check out reallifepharmacology.com. Get your free 31-page PDF on the top 200 drugs. It's a great study guide. It's a great review out in practice. Definitely go take advantage of that. Simply an email is going to get you access to that. And then we've also get you emails when we've got new content available as well, such as this podcast, for example. So the drug of the day today is Lisdexamfetamine. Brand name of this medication is Vyvanse. This is a CNS stimulant. It is a sympathomimetic agent. It is primarily going to release norepinephrine and dopamine, and it is going to be used in ADHD, and it also is indicated in binge eating disorder. The primary dosing range, initial dosing can be in the 10 to 30 milligram range. Obviously, if we're using potentially in pediatrics, younger patients, smaller patients, we're probably going to start more conservatively there. In adults, you may see 30 milligrams started on a regular basis there, up to typically a max of 70 milligrams per day. I will say there is some caution with renal impairment, and recommended max dose in a patient with 15 mils per minute to 30 mils per minute range. That maximum dose is recommended to be 50 milligrams per day. In patients with end-stage renal disease or creatinine clearance less than 15 mils per minute, we're looking at a maximum of 30 milligrams per day. So let's get into some of the risks and adverse effects with this agent. So first and foremost, FDA has put out a safety alert somewhat recently regarding specific language in regards to sharing prescription medications and abuse potential and things of that nature. So definitely important to take that seriously. This is a Schedule II controlled substance. So with that warning, high abuse potential, high risk for dependence. So that is definitely something that is weighed seriously when somebody's going to prescribe or dispense this medication. So other than that risk for abuse and dependence, we've got risk of reducing appetite. So particularly that may be more problematic or more concerning in pediatric patients where they are still growing. So that's something that should be monitored. Making sure that kids are growing at the potential or hopefully close to the potential of what they should be if we're using this medication, because again, it can suppress that appetite and reduce weight potentially. Insomnia, this is definitely one that I've seen in practice quite a bit, particularly if that dose tends to linger for some patients more than others. We may have some pharmacogenomic factors that may impact that, particularly with CYP2D6, because Lisdexamfetamine is actually metabolized to dextroamphetamine, which is ultimately metabolized to a significant extent by CYP2D6. So definitely some things to think about there if you've got patients that are non-responders, or maybe that drug is lingering longer and causing insomnia. So again, this drug is typically recommended to be taken in the morning, and that duration of action is going to be in the 8 to 14 hour range there. Other adverse effects, we can see some psychiatric changes, some irritability, some emotional changes. Definitely pay attention to that when we start this medication or increase the dose. And or potentially run into a drug interaction. So I'll talk more about drug interactions at the end, obviously, but that is definitely something in practice I think gets overlooked, where we don't pay attention to drug interactions, and that can actually increase concentrations. Blood pressure, pulse, those can both be elevated. Again, we're giving a sympathomimetic. We're stimulating that heart rate. We're potentially causing some vessel constriction as well. So that definitely should be paid attention to as well. And with that increase in blood pressure, increase in pulse, obviously there may be an increased risk for cardiovascular events as well. In general, it's going to be dose dependent. More stimulant we use, I think it makes sense that, the more we might push that blood pressure and pulse up. Loss of libido is certainly a possibility as well. Typically, more concerning in our adult population usually. Of course, addiction dependence, I mentioned the Schedule II controlled substance and the warnings associated with that. Rarely, and it's kind of controversial, that it may increase seizure risk. So that is, I think, an important thing to pay attention to, at least in patients that have seizure disorders or maybe predisposed to seizures as well. Serotonin syndrome is a rare potential. It's generally not something I worry about if we're just using Lisdexamfetamine. But if we've got patients with other medications on board that have serotonergic activity, that risk can certainly go higher and higher. Monitoring parameters, I think I kind of alluded to all of them. A cardiac assessment may be done, may be called for based upon the patient that you're looking at there. And then monitoring heart rate, blood pressure, that's going to be important. And then growth and weight, maybe more close attention in patients who are still who are younger and still need to go through puberty and growth phases as well. So certainly important things to pay attention to there. All right, let's take a quick break from our sponsor, and I'll wrap up with drug interactions. If you're in the market for any pharmacist board certification study material like BCPS, ambulatory care, geriatrics, BCMTMS, NAPLEX, or others, go check out meded101.com/store, S-T-O-R-E. We've got a growing list of resources, helped thousands of pharmacists pass their board exams, and certainly provided a great resource there. So again, your support at meded101.com/store helps support this podcast and keeps it available for all to benefit from. In addition, if you're another healthcare professional, popular books we've got the Flippin' Pharmacology flashcards. Those are available in the U.S. We've got a guide to drug-food interactions. That's been a popular book as well, and numerous other resources as well. Crossword puzzle books, fun things for studying and preparing, or maybe you've got a retired healthcare professional. All those links you can find at meded101.com/store. All right, wrapping up with drug interaction. So I mentioned that kinetic profile where lisdexamfetamine gets converted to dextroamphetamine, and that active metabolite is broken down by CYP2D6. So as you can imagine, any CYP2D6 inhibitors, bupropion, paroxetine, for example, they could potentially increase concentrations and increase overall activity of this stimulant. Okay, so definitely important to remember that one. Stimulants. So if we're adding on any medications that can have similar adverse effects. So I think of illicit drugs, so cocaine, methamphetamine. If a patient's doing that in addition to taking lisdexamfetamine, we're really increasing their risk for particularly cardiovascular problems, but certainly it could exacerbate loss in appetite and insomnia and things of that nature as well. And then I do mention caffeine as well. Patients who take excessive caffeine amounts particularly are vulnerable for increasing some of those cardiovascular risks there. Medications that can increase seizure risk, that is something that crosses my mind. So bupropion's a great example there. So pay attention to that lisdexamfetamine could potentially increase that risk slightly as well. Serotonergic agents, I mentioned serotonin syndrome, so antidepressants like SSRIs, TCAs, they can all increase serotonergic activity. Added on top of lisdexamfetamine, we could increase that risk for serotonin syndrome. And then last but not least, I wanted to mention acidic environments in the gut for absorption. So adding medications, particularly I think of the supplement vitamin C, can increase the acidity of the gut. And the more acidic the gut for absorption, the lower the absorption is. So, again, generally not going to be catastrophic, but if you've got a patient who's not responding to the medication anymore, maybe they started taking vitamin C supplements, for example, and that's reducing the absorption of the medication we're giving. So definitely something to pay attention to, something to dig into. If you've got a patient who maybe was previously responding and now they aren't, that certainly could be a potential factor to try to rule out. All right, well, I think that's going to wrap up the podcast for today. Hopefully you picked up some practice pearls. If you enjoyed this episode, please leave us a rating review on iTunes or wherever you're listening. Greatly appreciate that. Comments, suggestions, feel free to reach out to me at mededucation101@gmail.com. And of course, please take the time, if you're in a good financial state, definitely support the sponsor, meded101.com/store. All right, well, I'm going to sign off for today. Thank you so much for listening, and I hope you have a great rest of your day.